I guess it's time. Welcome, everyone. Welcome to the 2024 Recognition Ceremony for the Minor in Compassionate Care in Medicine. Sound effect not intended. My name is Dominic Vachon. I'm the director for the Hillebrand Center for Compassionate Care in Medicine here in the College of Science at the University of Notre Dame. And it is, I'm honored, happy. There's so many wonderful emotions celebrating 80 people who throughout their years here at Notre Dame have made the science of compassion a major part of their study here as a minor. But it's a major part of what they're doing, what they did here. And we're here to celebrate them and to confer to them the minor and the medallion, which is our logo, the heart of gold and the DNA double helix. So I'm going to talk a little bit, I'm going to begin and tell you a little bit of the story of how we got to this point. And the main part of today will be celebrating them individually and the capstone project that they did, and a few words afterwards. So with that, this is the medallion that we'll be giving the graduates. There's a lot of gold here, and there's a lot of gold there. It's a lot of gold. These are individuals, yes. They know how hard healthcare is right now. We never hid that from them, and many of you never hid that from them either. They know how hard it is. But they are the hope of the near future to make the world a better place. And so that is one of the deep feelings of awe and happiness that I have, that they have chosen to do this in such great numbers as well. So here's the place that they've called home for the last 4 years. But their story begins way before this time. The first teachers of compassion were all of you, the parents, the grandparents, the siblings, the loved ones, the friends. You are the first teachers of compassion. You are the foundation. Without you, this does not exist in so many ways. And then we come here to Notre Dame and we join another story, a big story of Notre Dame, founded by Basil Moreau to train the heart and the mind to make the world a better place. We join ourselves with this great story that it's gone now for so long that we get to join this. And then there are many stories, and I'm going to tell you a little bit about the faculty in a little bit, but all those stories come together in what we're doing here. And then other stories have come and joined this as well. And this is the first person for whom this center is named, Ruth Hillebrand. Ruth Hillebrand, through her brother Joseph, gave the first endowment to establish this center in 2011. Ruth's story was a tragic one, and she turned that story into what we have today. She was at home alone one night. She was a psychologist practicing in Manhattan, born and raised in Toledo. A physician called to tell her that she had terminal mesothelioma, and then after telling her that and saying that there was nothing that could be done, hung up. So that's a rough way to find out you're going to die and how you're going to die and the way it's told to you. But this is a remarkable woman who decided to turn that harshness into kindness. And so she was one of the first people to help endow this center. And her story animates what we do, and it centers us. Whenever we're not sure about what we're doing, we root ourselves in her story and all the other stories as well. This is her brother Joseph, a Notre Dame graduate, who said many doctors appear to be scientists before compassionate human beings, so my sister thought they needed to be trained to compassionately communicate with patients. And through Joseph and many other people at the Indiana School of Medicine, Dr. Naveri, Father Jim Foster, the Dean Crawford, so many other people over the years have made this a central part of the College of Science. And now Santiago Schnell is our dean What an awesome thing that the science of compassion is done in the College of Science at the University of Notre Dame. That's amazing. Other people have also contributed to this work. The Reich family endowed through their own difficult healthcare story as well, through their son, Thomas, established the Reich Family Endowment for excellence on the care of the whole patient. And their endowment helps us with courses like Spiritualities of Caring. It helps us with research. It helps us with the Pathos Project. Not so long ago, the Sheedy family, in honor of Dr. John Sheedy, family physician, an exemplary physician, added to this endowment to honor him. And so now we have a story of an exemplary physician. So more and more of these stories come together and they animate and they center us about what we're supposed to be doing. Last year, the Molyneux family established an endowment for excellence in compassionate care in medicine. And that's the first time we were able, through that endowment, to add one of our first nursing faculty, whom I'll tell you about in a little bit. And then last year, the San Pedro family has also established an endowment for excellence in compassionate care in medicine. And their endowment has helped us expand medical counseling skills because as you all signed up, we're like, we don't have enough classes for you and we don't have enough faculty. And so we thank the San Pedro family for all that. So let's give a hand to all these wonderful donors. Our mission is to restore a spirit of compassion in healthcare by advancing the science of compassion, applying the science of compassion at every level of medical training and practice. And we do that not only for excellent patient care, we do that for the well-being of the clinicians. Because as you know, we're living this, we're all hurting right now. We're all feeling a crisis of compassion. The loved ones feel it, the patients feel it, the clinicians feel it. We don't have enough people to do the work. There's a lot in front of us in terms of how to fix this in our country and in the world. But that's our mission. And so that connects to an ancient story, which is about being human. So it's a newer story, Science of Compassion, but it's an ancient story because this picture here by Alex Gray kind of captures what it's like to be human, that we can't be human by ourselves. We need people at every stage of our lives. And we humans are built to give and receive compassion. We're built so that when somebody's in pain, somebody's in distress, we notice it and we want to do something about that. And that is the secret to our success as human beings. That's why we evolved as a species that we are, because of compassion and the way we're built. So at Notre Dame, we don't invent compassion, we help cultivate it. And we use now, this is a newer thing. Science of compassion hasn't been around as a formal discipline until about 2011, 2012. And this is where we're doing biology of compassion and neuroscience of compassion and psychology of compassion to say, what is compassion really? Now the students who are the graduates will notice that I am holding myself back here. But I'm against sentimentality of compassion. People treat compassion as a nice puppy dog, you know. I have nothing against puppy dogs, okay? I need a dog named Compassion. But a lot of times when people think about compassion, they think about it as a nice, cute thing to have, but they don't really need it. And there are actually people in healthcare, you and I all know this, who think that you can do medical care without caring and compassion. And one of the problems we've had is that when you go and start doing this work, being sentimental, rainbows and holding hands and singing songs is not the world we're going into. It's not all rainbows and New Age music. What is going to sustain us in doing this work? And so what we've been about here, and thanks to the science of compassion, the story of how that came about, what that does is it really helps us understand what compassion really is and how to use it and rely on it in our work. So science of compassion is a lot like the Hubble telescope or the James Webb telescope. The James Webb telescope and the Hubble telescope didn't invent galaxies. They were there all along. But because of those instruments, we have been able to see them for the first time. But they were always there. Science of compassion is the same. Compassion is as old as we are as a species. But now with these instruments, things like fMRI machines, we're able to see what our brain, what our bodies are like when they're in a state of compassion. That's amazing. And through that tool, we're more clear about how to give really good care to our patients and how to take care of ourselves at the same time. Now, a lot of you are saying, wait, that's true for my life too, right? I'm a parent, I do this work or that work. Yes, it is. It's true about being human in general. We look at it in particular in healthcare. Like, how do we do this work and keep doing this work? But the main thing to remember is we're built for compassion. This is the way we're built. And when we don't honor the way we're built, we don't do very well at it. We're not happy at it. When we really come from this compassionate place, that's when our best care happens, and that's when we're our happiest. So this science of compassion is that brain state, that when you're in this state, it organizes your brain a certain way. It's a way of, when you think about times you've been with people who have been in pain, who have been going through difficulty, and how hard that was inside you when you were with them. And then something happens inside you where you go, I notice this suffering, I'm moved by it, I want to do something about it, and then I actually do something about it. See, I actually got the definition of compassion snuck in there. But that's the way we're built as human beings. We can be overwhelmed by suffering, and then we channel it into compassion. And so this image right here is what our brain looks like when we're in a state of compassion. When we notice suffering, when we're moved by it, we empathize with it, and then that green area are the parts of the brain that are compassion. And so what happens in human beings in general, but especially in healthcare, which they're trained to do, is first of all to know how do you get in a state of compassion. I was going to the five-finger model, and I don't want to do that. That's a little mnemonic that your hand is the brain and the 5 areas. I better not do that. But when we're in a mental state of compassion, 5 things happen. The first thing is when you're in a compassionate state, you're centered. You're focused on the patient in front of you. All your attention is going to them. The second thing that happens is that when your brain is in that state, you are able to use your knowledge, your competence in the best way possible. You can access all those years of organic chemistry and physics and anatomy and so on, and you can use it for the person in front of you. And the third thing that happens when your brain is in a state of compassion, your patients can feel it. They can feel it. They feel safe. They feel cared for. And the other thing is medical outcomes are actually better. So as cute as this little puppy dog is of compassion, this thing we call compassion actually is the difference between mediocre care and excellent care for patients. And the fourth thing that happens when your brain is in a state of compassion is that you are resilient. You can buffer burnout. This is still hard work. It will still be difficult. But in that state, we know how to bounce back. And the fifth thing is, when you're in a mental state of compassion and you walk into a room, people can feel it. Your colleagues, the patients, the loved ones. When you're in this state of mind, people around you can feel it. And you can feel theirs as well. And so the cool thing about this is that the research is so clear that compassion is critically important for patient care, but it also keeps people from burning out, or at least it keeps them going. And the other thing is organizations are more successful when they're based on this. So here at Notre Dame, this is an experiment that your sons and daughters, your friends, your relatives, and these 80 graduates, they've taken a risk. This is a newer area. Medical schools and residency programs and dental programs and veterinary medicine don't know a lot about science of compassion yet. This is a new thing. This is the only program in the country right now that is doing this. There's so many things I want to say about that. I'm going to curb that. But these graduates have taken a risk by doing this because it's not clear what it's about. Medical schools are learning how to integrate it at this time. But the really neat thing is we now realize that this is part of their medical training, not something that's delayed later on. They're not getting ready to be trained. They already started training. So let me tell you a little bit about that. Let me show you some pictures. What we do here, well, I'm going to keep talking until it comes back. What we do here, okay. Wow, thank you, John and Kat. What we do here, a lot of times people focus on training the outside, the communication skills. We know you just can't just train the outside, not just bedside manner. You've got to train the insides. And that's what we're doing. Compassion science is training the inside so that it animates what's going on in the outside. This is the cartoon your sons and daughters will know by heart. This is the whole program right here. Surgeon comes out of the OR and says to the loved one in the waiting room, the nurses and technicians did all they could. I just wasn't into it. Compassion for us is being into it. If you have the best surgeon in the world and they're not into you, you're not going to get a great surgery, even if they're the best in the world. So compassionate caring is about being into it. They have a trick question that they all have to answer at the end of the Compassionate Care Medical Professions course. What's more important, a smart doctor or a caring doctor? If they answer either one of those, they get it wrong. Because for us, compassion and competence, compassion and being a great doctor are one and the same, or whatever your health profession is, being a PA, a nurse practitioner, a therapist, whatever it might be. So with the minor, this experiment that we're living, that Notre Dame took a risk doing, this is the 14th year. About 6 years ago, we were doing these courses, and the students, I want you to know this because in the story of this, we put out the courses, but it's the students who made it what it is right now. And so what happened 7 years ago is that students said, I'm taking all of these courses, why can't I get a minor for this? And we're like going, you want a minor for this? Like, why would you want a minor in this? Can you believe that I actually said that? But I'm like, why would you want a minor? Aren't you so busy with so many other things? And so we did it. And thanks to Dr. Kathleen Kohlberg and Father Jim Foster and many other people, we have this minor. And the first year we graduated 3 people. And then I think we have this here. And then the next year was 18 people. And then the next year was 35 people and 34 people. Then last year 72 and now 80. And there's a lot more coming next year. So what do they do? And the other thing that's happening is that people from around the country are interested in this. So we're having our second summit in compassion science in healthcare. Because what's really neat about this is as burnt out as people are, this honors why everybody went into healthcare, the compassionate caring. To get rid of that is getting rid of our lifeblood. And so science of compassion gives us a tool to keep ourselves anchored in these really turbulent times. So let me show you some pictures of what they did while they were here. This is the 7th floor. This is in the stadium, 7th floor in Corbett. This is compassionate care in the medical professions, what we call the Gateway course. It's the introductory course to science of compassion. And in that, we have ways to do in small groups, big groups. We have guest speakers. We have several faculty who shepherd this course. This is Dr. Mark Sandock here with the words, be clear and realistic about the outcome. Like I said earlier, we do not hide the truth about what healthcare is like. We talk about compassion as it really is going to be, as hard as it's going to be. And students, while they're doing this, are discerning what their path is going to be. They all want to do something. They figure out what their call is when they do things like this. One of the things we do is belay training as an analogy for what it's like to take care of patients. Like, what? You were climbing as part of class? Yes, they were climbing as part of class. It's too late. They've already done it. You can't get your money back now. But we look at climbing. We have this wonderful wall in Duncan where you climb. You can see how tall that looks, even taller here. But it's pretty tall. And then this is Ray here, who you're the belayer. A belayer means you're the person with a belay device and the rope threaded through that. And your job is to keep your hand on the rope using that belay device so that your climber doesn't fall. And that's what we use as an image for what it's like to do patient care. And this belay device is kind of our brain, our compassion science, like how does it work? So that's one of the things we do in that course. Medical counseling skills, a lot of them took this. All of them had to do an experiential course. So some of them did summer service projects, or they worked in other courses where they had a service experience. Medical counseling skills is where we have simulated patient actors. And this is an example here of in-class role-playing with our patient actors. And that person in the background there is Dr. Lynn Damitz, who looks rather, very holy right there, almost like an icon. But she's a surgeon. I'll tell you about her in a little bit. She's a surgeon who was supervising the class from University of North Carolina. And here are some more of our faculty, again, debriefing. We go in, it's kind of like 50 First Dates meets Groundhog Day. You go in, you work with the patient, you come out, we debrief, then we go, let's do that again. Let's do that again. And then we have the Introduction to Hospice and Palliative Care course. This is a joint venture with the Center for Hospice and many other clinicians to introduce students to the reality and how to, in-depth knowledge of hospice and palliative care. And Cindy, is this our 9th year that we've done this? We've done this 9 times together with the Center for Hospice in the community. We have other courses like Introduction to Personalism in Medicine, Spiritualities of Caring in the Helping Professions, Psychology in Medicine, Clinical Ethics, and so on. The neat thing about this is that there's 3 requirements, but there's 2 electives, so every one of these graduates has gotten a special niche that they have explored, whether it be global health or ethics or whatever it might be. So every minor in compassionate care and medicine has a special fingerprint according to what their interests are, and you're going to see it in a moment with their capstone projects. So our logo again, let me just take you through the faculty for this. This is myself. My glasses are smaller now and the hair is just a little different. This is Father Jim Foster. Oh, yeah. Father Jim Foster is the Associate Dean for Undergraduate Studies. He's the chair of the Department for Professional Studies and the director for the Center for Healthcare Advising. He teaches the Introduction to Clinical Ethics course. I refer to him respectfully and affectionately as my boss. And I'm very thankful to him for his support in this kind of experiment that we've been doing for the last 14 years. This is Dr. Kathleen Kohlberg, who's the Associate Dean for Advising and Academic Affairs, also in the Center for Health Sciences Advising. And Kathleen has been a wonderful colleague, like I said, helping us engineer the minor itself and teaching us how to navigate that in a university system, which is not an easy thing. But thanks to Kathleen, we were able to do that. She teaches psychology and medicine, embryology and other courses, but especially psychology and medicine. A number of these faculty are not here today, but I wanted you to meet them. This is Dr. Abby Batches. Dr. Abby Batches is a family medicine physician. She started helping us when she was a resident, and now she's in private practice with St. Joseph Health System here in South Bend. This is Dr. Kate Callahan. right there. Dr. Kate Callahan is a family physician. She's also on the faculty at the Memorial Family Medicine Residency Program here in South Bend. And she is one of our adjunct faculty who helps teach the Compassionate Care in Medicine course and Spiritualities of Caring in the Helping Professions. This is Dr. Lindsay Connolly. I didn't see if she snuck in yet. Dr. Lindsay Connolly is an OB physician practicing here in Mishawaka. Dr. Lindsay Connolly helps us teach medical counseling skills, which is a course she took in 2012. So we have people now coming back to help us teach. And some of the role plays are exactly the same. This is a new faculty person this last year, Dr. Suzanne Courtney. And she will be so surprised that we found her nursing graduation. This is going to be great when she finds out we found that. Dr. Suzanne Courtney is a pediatric psychologist. She's also, for years, been on faculty training new family medicine physician residents. And so Dr. Courtney helps us teach medical counseling skills. This is Dr. Lynn Damitz, Notre Dame grad. She is the chief of plastic and reconstructive surgery at University of North Carolina, Chapel Hill. She is a surgeon. She is an administrator. She works with all types of patients. She trains residents and fellows. And she is a person, her motto is, as a surgeon, we have the least amount of time to communicate, therefore we have to be the best at it. Isn't that awesome? That's the way she trains. And we are lucky enough to have her be with us several times a semester. This is Dr. Paul Dietrichak, who might be coming in a little later. Dr. Dietrichak is an ICU physician who practiced for many years across the border in Niles, Michigan. He helps us teach the capstone course or mentor the capstone projects. And he's been with us now for several years. What I love about this picture, and we don't have a good answer for it, is what's this nipple about over here on the left-hand side? There's a story, on the theme of stories, there's a story there. This is Marcus Engel. Marcus Engel is a narrative medicine specialist, expert. That's his expertise. He does keynote talks throughout the country. He's a consultant in healthcare. Marcus, when he was a first-year college student, was hit, his car was hit by a drunk driver and he became blind and he needed 350 hours of surgery after that. Marcus shares his wisdom with us. And it's a pretty powerful thing when a patient, a former patient, teaches us about what they need when we become their clinicians later on. This is Dr. Gary Fromm, an ICU doctor here in South Bend, also teaches at the medical school. Many people have taken Dr. Fromm's courses, which was Film and the Physician. This is Professor Christy Lax-Walker, who's right here. Professor Lax-Walker has been here at Notre Dame a number of years, but this year she joined our faculty and helps to teach the medical counseling skills courses and is helping us move that whole course further. So I'm very grateful to you, Professor Lax-Walker, for that. This year, Father Mark Poorman became a guest faculty. He's the Holy Cross priest and the previous president at the University of Portland, and he has been involved in healthcare his career. And he became interested in compassion science, and he joined us this year and helped us to teach compassionate care in medicine. This is Rachel Rose. Rachel Rose is our first nurse faculty. Rachel Rose works as an OB nurse. She works, I always get, start me off on
Perinatal Outreach and Hospice Coordinator.
Perinatal Outreach and Hospice Coordinator. I've known her for many years. In fact, my whole time in the residency program that I came from before I came to Notre Dame, I got to work with Rachel Rose. Rachel Rose helps us to teach compassionate care in medicine, as well as several other courses like Spiritualities of Caring in the helping professions. This is Dr. Anton Salud. Dr. Anton Salud is an ICU doctor. We're kind of partial to ICU doctors, it looks like. He's an ICU doctor at Ascension St. Mary's in Milwaukee. He helps us teach the Pathos Project. This is Dr. Mark Sandock, whom many, I think all of you know here. He's internal medicine, practiced many years here in South Bend, was an administrator at 2 hospitals, so we get that wealth of experience, and he helps us teach compassionate care in the medical professions. We have Cindy Sirfos, who is also our 3rd new faculty this year. Professor Sirfos is an adjunct faculty. Now, this is another one. I practiced this title before. She's the Director of Marketing, Communications, and Education at the Center for Hospice. Is that close? Okay. I've known Cindy for many years, but this year it's like we need Cindy to be one of our adjunct faculty as well. This is Dr. Stephen Treziak, Chief of Medicine at Cooper Health in New Jersey. He's a resuscitation researcher and an ICU physician who, because of his son, became interested in research on compassion. And he ended up writing this book called Compassionomics, which shows us all the research on how compassion makes a difference in healthcare. And last but not least is Dr. Brandon Zabukovic. Dr. Zabukovic is a family physician who is the founder and director of Primary Care Partners, a very wonderful practice here in the community. He helps teach medical counseling skills, and when students shadow him who have taken medical counseling skills, they say about him, he really walks the walk. He really practices what he preaches. So those are our faculty, but Rose Carroll is the operations and strategic coordinator, and all the students will tell you she is the glue as we become big and with many parts that need to be held together. Rose Carroll, Notre Dame grad, loves Notre Dame and loves this center and loves your students so much and takes, with 18 people to help find their way, who some of them don't like computers or not certain parts of teaching, but other parts yes, or things happen, emergencies happen, and we have to figure out what to do. Rose is the person who is helping all of that still keep going. And so Rose, really want to thank you for your work. Okay, so with that, we now move to the story of what they did while they were here. So you got a little bit of their background, that they learned science of compassion. They learned about how to train their mind to be activated in these 5 ways that I told you about. They practice it either in a medical counseling skills or in some other service work. They did 2 other courses of areas that they were really gripped by. All of them are gripped by some area of some problem, some suffering, and they've devoted themselves to studying that. And then what happened in the capstone is at least a semester, but some of them did it for more than that. They studied an area that really mattered to them. They reviewed the research on that. They might have done a study. They've consulted with people about that. And so when we think about doing a ceremony that honors them to confer the minor, it seems most appropriate that we call them by name, but then tell you what their project is. And so that's what we're going to transition to right now. So right now I'd like to hand this over to Dr. Kate Callahan, who's going to MC that part of our ceremony.
Awesome. Well, if you all will indulge me for just a few more moments. As Dr. Vachon said it, my name is Kate Callahan, and in addition to my work here at the university, I also serve as one of the associate directors for Memorial's Family Medicine residency program. And within that role, one of the most important pieces of my clinical work is caring for individuals experiencing homelessness. While I get to do this at my office and in the hospital, the most meaningful part of that happens through a street medicine outreach that we run every other Thursday night offering direct care at a low-barrier shelter in town. In and through that work, I've thought a lot about the idea of home and what home really means. And as we gather to celebrate these 80 wonderful graduates, and all of you who have helped them become the extraordinary people that they are, I can't help but reflect on the unique experiences of home that commencement marks. For all the parents and loved ones, siblings, grandparents, friends, you have planted seeds of home in each of these graduates in important ways throughout their lives. Your love has taught them what it means to belong and to give belonging to others. Your love brought them to this university, and it has sustained them during their time here. You have been sources of home for these 8 remarkable young people that we celebrate today. And for each of you graduates, I sincerely hope that you have experienced home here, as Dr. Vachon said. I hope that there are places, but likely more importantly, people that you call to mind from your time here with a warmth and fondness because they have been further teachers of the lessons of belonging, instructing you in what it means to give and receive care. I hope that during your time here, you have stored up tastes of home that will be for you a banquet to return to whenever you need a reminder of the truth of who you are and to whom you belong. Know that those of you that I've had the privilege to know, many of you, over the last several years, and I believe even in those of you that I have not, have helped further my experience of home in this place through your commitment to compassion. Your desire to deeply understand and be agents of compassion is greater encouragement to me than you will likely ever know. It gives me such hope to think of each of you moving out into the world, carrying all of your experiences of home on and beyond this campus forward with you, gifting experiences of home inevitably to others through your compassion and through your care. As we award you a tangible representation of your work in compassion, I have the honor of reading each of your names and the unique projects that you've dedicated yourselves to through this past academic year. While your time here on stage will be brief, please know that your faculty in the Hillebrand Center, all of us here and so many who can't be here with us today, see and know and give such thanks for the extensive effort that has gone into each of your capstone projects and all of the work that you have done for the minor. In reviewing them, the words of Charlie Mackesy in his The Boy, the Mole, the Fox, and the Horse have continually come to mind. Always remember that you matter, you're important, and you are loved. And you bring to this world things that no one else can. So without further ado, I would ask the first 5 rows of graduates. We're going to kind of wrap up and around here, and then you'll come to this first step on the stage and wait until your name is called there, but that will hopefully minimize lapses here as we move 80 of you brilliant people through this process. So.
You are free to clap all you'd like. This is our ceremony. We can do whatever we want. But let's just, I invite you to really let sink in the depth of this study that your sons and daughters, your friends, your relatives have done over these last several years, especially this last semester.
Awesome. And then for this last row, we may just have you sit until there's more space in the back there, just so we don't obstruct the view of these folks sitting here to our right. So if you can just kind of watch the line there and get up and head back that way once we have a few less people standing. Awesome. All right, then, to start, Kevin Armnecht, Decline in Compassionate Care in Hospice and Palliative Care.
Thank you for doing this.
Thank you. Thank you.
Hold on a second.
Amanda Arnold. Ooh.
Okay, there's Kevin. Right, we don't want to shortchange him. Oh. Okay. Doggone it. Oh. Well, maybe.
Amanda Arnold, Compassionate and Effective Communication with Patients with Intellectual and Developmental Disabilities.
Amanda, congratulations. I'm so sorry about that. But thank you for doing this program.
Sophia Baker, Infertility experienced by female physicians and sexism in maternal health within medical education.
Thank you for doing this, man. And good luck in all that you do.
Ella Batts, maximizing the physician assistant relationship from a lens of well-being, job satisfaction, and compassionate patient care.
Stay in touch. Thank you for everything.
Ryan Benevento is not with us, but he looked
Oh, no,
at
she's here.
beautiful. Analyzing female infertility through a compassion science lens,
Ryan.
implications for the patient, physician, and course of treatment.
Thank you
Thanks,
for
Ryan.
doing the minor.
Margaret Berquist, new drugs, new methods, the role of compassion science in addiction treatment.
Meg, what a great number of years. I'm so glad to know you. Congratulations.
Ava Bidner, compassion in mental health care, navigating the effects of COVID-19 on the mental health of children and
Good
adolescents.
luck to you.
Kylie Boyer, facing medical school with a learning disability.
Kylie, wow, what a journey. Thank you for everything that you've been doing, and good luck in everything.
Ethan Boyle, effects of transcutaneous vagal nerve stimulation on adolescent emotion dysregulation and suicidal ideation.
Ethan, it is great to know you. Thank you for doing all the wonderful, and I stay in touch. 'Cause I
Jillian
really believe
Bruner,
what you're doing.
optimizing postpartum patient care, comprehensive physician interventions from pregnancy to parenthood.
Congratulations. Thank you for all your hard work. Really gutsy stuff that you did. You know.
Isabella Catania, the consequences of differential patient-physician relationships among African American and white breast cancer patients.
Congratulations. Thanks for all your work. Stay in touch. Good luck with everything.
Madeline Chung, mitigating physician burnout in emergency medicine through societal, organizational, and individual interventions.
Madeline, congratulations. Thanks for all your work. Good luck to everything that you're going to do.
Iselina Kolsman, the vitality of compassionate care in treating mental distress and disorders in refugees living in Germany.
Did we get Lily?
Lily Darman, examining compassion in pediatric surgical oncology.
Hi, Lily. Thanks for all your work. Good luck in everything that you're going to do.
Savannah Dean, animal-assisted therapies in healthcare and in the community.
Savannah, it's so good to know you. Thanks for everything that you brought to us.
Haley
luck.
Deek, the opioid epidemic, caring for patients battling drug abuse with a focus on anesthesiologists.
Haley, it's great to know you. Congratulations. Good luck on everything that you're going to do.
Grace Drever, the coexistence of cutting and compassion, an analysis of the
Grace.
stereotypical surgeon through a compassionate care
Thank you
lens.
very much for what you've done.
Emma Eckstein, compassion-based health initiatives within the intellectually disabled community.
Hi, Emma. Congratulations. Thanks for doing the minor and best in everything you're going to do.
Tori Elliott, the heart of cardiac transplantation procedures, a compassionate approach to transplant.
Congratulations. Thanks for doing the minor. Blessings on everything you're going to do.
We're honored to have the salutatorian as one of our minors. He's unfortunately not here, but Shaker Urbini his project was increasing cultural competence in healthcare for Muslim patients, a compassionate caring perspective. Caroline Flick, clinician compassion and its influence on patients' diabetes outcomes.
Thank you for doing the minor. So good to know you. And good luck on everything you're going to do.
Maria Freck, the professional relationship between doctors and nurses, how consistent communication
Delight
provides
to know
coordinated
you.
care.
Congratulations and good luck with everything you're going to do.
Liliana Freiner, language barriers as a barrier to compassionate healthcare.
It's so good to know you. Thank you for doing the minor and everything you did. Good luck with everything.
Megan Gallion, chronically misunderstood, the need for compassionate, comprehensive care for long COVID patients and patients with chronic conditions
Megan
induced
Gallion.
by COVID-19.
Right. I'm so glad to work with you. Blessings on everything you're going to do.
John Gonaldo, analyzing the benefits of compassionate care training in graduate medical education.
John Donaldo, how can we go on without you? It's good to know you. Thank you for doing the minor.
Grace Hake, storytelling for healing, narrative medicine as a tool for elevating patient-physician connections.
Congratulations. Hey, thank you for doing the minor. Good luck with everything you're going to do.
Cameron Hagee, using compassionate care to alleviate dental anxiety.
Cameron, congratulations. Thank you for doing all that. It's a pleasure to work with you.
Zachary Hahn, pediatric biomedical ethics, creating a mindset to best serve patients.
Zachary, I love your energy. Keep up your wonderful work.
Alyssa Hardaby, exploring the role of cultural competency practices in promoting compassionate care in medicine. Joseph Heitzman, confronting the healthcare accessibility crisis through the compassion of street medicine. Christina Holman, orthopedic oncology and breaking bad news. Dylan Hodder, compassion for depression and the science behind it. Megan Holly, combating the medical malpractice crisis in obstetrics and gynecology, the science of compassion approach. Olivia Shin, integrated approaches to ADHD management in minority children. Nikki Iamonico, federally qualified health centers, benefits, challenges, and improvements through compassionate care. Caroline Eisman, is compassion in prison medicine possible? An argument for why it is not only possible, but necessary. Reimer Havelosa, investigating a potential framework for patient-centered care and intersection with multicultural underserved communities. Julia Jensen, compassionate care for chronic stress, understanding neurobiological changes and healing through biopsychosocial treatment. Amber June, uncovering the significance of nonverbal communication in the light of technological advancements for delivering care with compassion. Stephen Casco, alternative medicine and refusal of treatment in oncology. Matthew Kiampur, Salud, Stress, and Healthcare Seclusion, a mixed method study of psychological stress of Latina mothers in South Bend, Indiana. Emily Pack is not with us, but her, so we'll honor her in compassion. Matthew Long, the United States veteran in the civilian healthcare system as both patient and provider. Elizabeth Lucas, mechanics, healers, or both, examining compassion in surgical fields. Shannon Lydon, managing the psychosocial needs of patients in pediatric healthcare. Julia Maloney, addressing the psychological needs of injured athletes. Raven Mengundayo, providing compassionate care in cross-cultural contexts. Used Muzzer, practicing patient-centered care in the disabled patient population. Ethan Munir, compassionate care for children with chronic conditions. Alexa Misticelli, compassion and end-of-life care. Megan Moore, a compassionate care approach to addressing barriers in pediatric medicine. Cassidy Mullen, compassionate care in treating, managing, and diagnosing sports injuries in female athletes. The impact of the compassionate physician on maintaining female participation in sports and enhancing the physical and mental well-being of women and girls. Ella Murphy, Evolving Patient Care and Chronic Disease Management, Navigating Through Compassion and Communication. Mary Musselman, Exploring the Significance of Inner Speech in Patient-Doctor Interactions, Knowing the Self to Heal the Self. Sandy Sungyen Nam, Practice of Compassionate Care by Certified Child Life Specialists in Pediatric Care, The Hidden Supporters in Pediatrics. Elizabeth Nava, Compassionate Perspectives on Trauma, Overcoming Mental Health Obstacles in Latino Immigrant Communities. Kayla Nguyen, Adapting to Compassionate Caring Principles to Better Serve the Needs of Patients with Rare Diseases. Tess Noonan, Compassionate Caring in the Emergency Department. Michael Oblick, Overcoming Differential Barriers to Compassionate Care, How Medical Specialization and Training Stage Impact, Compassion, and Burnout. Ashley O, A Review of Compassion in Hospice Care, Outcomes and Methods. Emily Patterson, Patient-Centered Practice of American Gynecological Visits and Procedures. I'm so sorry.
Oh, there we go. Here she is.
Emma, hold on.
Okay, Emily Patterson.
I got you.
Now Emily
Emma Lepak, How Compassion Science Can Be Used in the Return to Play Process for Injured Athletes. Sarah Peterson, A Touch is Worth 1,000 Words, The Role of Physical Touch in Compassionate Care. Mary Claire Powell, Compassionate Care and Palliative Care Nursing. Nikki Reinhart, Applying a Compassionate Patient-Centered Mindset to the Surgical Experience, Implications for Patient and Clinician Benefits. Chris Rizkali, Healthcare in Lebanon, A System in Crisis in the Aftermath of COVID-19 Pandemic, Beirut Port, Explosion, and Economic Stability. Heather Rowland, Compassionate Care in U.S. Public Health. Stevie San Pedro, Child and Adolescent Psychiatry, The Rise in Mental Health Issues. Valeria Sanchez, Applying the Compassion Science Model when Faced with Language and Cultural Barriers. Annie Kate Schmidt, The Compassionate Care of Bone Marrow Transplant Patients, Improving Patient Well-Being. Ashley Schmidt, A Good Death, Compassionate Care in Euthanasia and Veterinary Medicine. Ellie Shetty, Utilizing Compassionate Care to Confront the Barriers Facing Latino LEP Patients. Sarah Snelson, School Counselors and Students with Disabilities Through the Lens of Compassionate Care. Karina Solman, Fixing Smiles One Relationship at a Time, an exploration of polyvagal theory as a preventative measure against dental anxiety. Jules Suchek, Treatment of Pregnant Women with Substance Use Disorder. Kevin Stein, Providing Compassionate Care for Those Experiencing Chronic Homelessness. Elijah Tan, Bridging Medicine and Research with Compassion. Natalie Tihansky, Compassionate Caring, Trauma-Informed Care Addressing Domestic Violence and Sexual Assault. Emma Westrick, Analyzing Organ Donation Through a Compassionate Lens. And last but certainly not least, Sophia Zitella, Maternal Mortality Through the Lens of Compassionate Caring.
Four o'clock, that's good. I bet you thought 80 people, we could be here a long time. Wasn't that amazing? I mean, wasn't that amazing? It is so powerful, and I've gotten to read those, and then I've also gotten to keep reading them over and over again, and I'm just so in awe of what they're doing. I think there was a point where we were ready to let go of the capstone. Is it worth the work? And a number of them said, no, this is my independent study. This is what I believe in. This is what I want to deepen my knowledge of for the future. So thank you for doing all of that. And before we leave the capstones, Dr. Dietrichak, is Dr. Dietrichak here? He was going to read these. He's not here yet. And is the dean here? And there's another person I thought might pop in. We'll just keep an eye at the doors in case that happens. So we had difficulty making decisions. We wanted to give an award for every single person who did the capstone because they were amazing. But we would like to recognize 6 people for their capstone in terms of their originality and for moving the field forward in the science of compassion. And so I'm going to read their name, and we have a little monetary award in there to help you with your future training. It won't get you through a whole year, but it's way more than several meals. So the first person we'd like to recognize is Emily Pack, How Compassion Science Can Be Used in Return to Play Process for Injured Athletes. What I'll do is should we do them individually? It's nicer when it's individual. Let's do it individually. Okay. This is why it's nice to have an adjunct faculty. They help you stay on track. The next person we'd like to recognize for compassionate care for chronic stress, understanding neurobiological changes, and healing through biopsychosocial treatment, Julia Jensen. The vitality of compassionate care in treating mental distress and disorders in refugees living in Germany is Helena Kolsman. I don't think Helena is here, but we'll give it to her later. The coexistence of cutting and compassion, an analysis of the stereotypical surgeon through a compassionate care lens, Grace Drever. Run right up there. This person is not here yet. Our 5th award goes to Chronically Misunderstood, the need for compassionate, comprehensive care for long COVID patients and patients with chronic conditions induced by COVID-19, Megan Gallion. There's one more, and I'll say his name, but he is the salutatorian for this year's graduation. His name is Shaker Urbany. His capstone was Increasing Cultural Competence in Healthcare for Muslim Patients, a Compassionate Caring Perspective. Shaker is at rehearsal. He might be coming in shortly, and I said, Shaker, it's just us, so just walk in, and if you walk in before we end, we're going to call you up. There he is, all right on time. Shaker Urbany. Come on in, Shaker. That's what I call a dramatic entrance. Come on up. Wow. Thank you. Oh, that's perfect. That is perfect. I'm so glad you're here, Shaker. I was worried that we were going to end. We're ending a little earlier than I thought. So a couple of things that I'd like to do, and we might have one more person dropping in, so I'm keeping an eye at the doors. And so hopefully that person comes in, and if not, at the end, Father Jim Foster is going to give us a sending prayer. But I want to say a few things to acknowledge people who helped make all of this happen. I want to acknowledge the people here in Washington Hall who had a lot going on behind the scenes where they're cutting in and out, and there's some people who are really sweating in the back. So I want to acknowledge that they made it happen. First of all, I want to acknowledge Kat Van Vliet, who is the director. Where are you, Kat? Are you around? She's in the back. But anyway, Kat has been our main person to make things happen here. And then John Ermiter up at, he's really sweating after all that just happened. And then Shane Reardon, and then our ushers, Paula and Barb. Thank you for all that you do to keep all of these wonderful ceremonies going here. I want to thank our interns who are all here. And if they would stand, Megan Gallion and Ella Batts. If you just stand, yeah. And Ella Batts, who are also on the research team, along with Julia Maloney. Would you stand, Julia? That was, so thank you. And she's a junior, but she's been instrumental, and she actually did her capstone this year, Leah Brucal, who's in the back. So saying thank you to Rose Carroll is something you just want to keep doing, because she does everything she does with great joy and great compassion. Like when you get the perfect person for the Center for Compassionate Care in Medicine, you don't take that for granted. So Rose Carroll, thank you for all the details, everything that you've done. And for her husband, who has given us a lot of free labor. Other people I want to thank. I want to thank these people here, these faculty and the people who are not here. We're recording it for them, and if there are people, loved ones, that you want to share that recording with, let us know, because we know not everybody can be here on a Friday afternoon. But to get to work with these people, I mean, what's driven this is your sons and daughters wanting to do this. And we, there was a talk about, should we cap the compassion minor at Notre Dame? This was serious talk. And I'm like going, you can cap it, but I don't want the PR disaster that would happen that Dr. Dominic Vachon has capped compassion at Notre Dame. No, thank you. I am not getting that PR problem. We wanted to respond to what your sons and daughters and your loved ones wanted. And these people here have made that possible. They're doing practices, they have day jobs, and they come one day a week, sometimes whole semesters, taking over courses, parts of courses. I want to thank the adjunct faculty for everything that they do. There are other people, and believe me, I've thought about showing their pictures, but it's a bit too much after a while at a long weekend. That's all wonderful, but you still want things more concise. But we have about 10 physicians and nurses and therapists who do guest lectures and help us out. There are people who call us and say, tell us what we can do to help you out. There are people, of course, like the San Pedro family and the Molyneux family, and the Sheedy family and the Reich family that keep us going. And then there's lots of people who do wonderful things to keep us going. And what they say is it gives us energy and hope for the future that we get to be a part of this. And with that, I really want to thank the College of Science. Dean Santiago is, you can imagine as Dean of the College of Science, he is running from one thing to the next. And, but I'll definitely show him this recording. But Dean Santiago and the College of Science, they give us, talk about a home, Dr. Callahan, they give us a home in the College of Science and all the respectability that comes with doing science of compassion in the College of Science. And I don't take that for granted. And I think all of those, you all know, universities and colleges and politics. To have something like this is a wonderful miracle to have this. So I thank the College of Science, Notre Dame, and Dean Schnell for that. And with that, I've already thanked them before, but Dr. Kohlberg, who has helped engineer a lot of this, Miner helped us navigate that. And then my boss, which he hates it when I call him my boss. But Father Jim Foster, and I didn't say this when I was telling you about people, he's an infectious disease physician, and he's a Holy Cross priest. And that is an amazing combination because he really gets what this is about. Because it's easy to sentimentalize compassion, to think it's a nice thing, and oh, those are nice classes with rainbows and unicorns in them. But what we do here is about how do we help these wonderful graduates get ready for hard work. And so I thank you, Father Foster, for everything you do to support this program. So can we... Anything I've forgotten?
How about the people taking the pictures?
Of course. Steve Tepp and Brendan, who are our photographers, can we give them a hand? Thank you, Kathleen. Before I ask Father Foster to come up, I want to thank you 80 people, you 80 graduates. I'm going to miss you. We're going to miss you. Your energy in classes, we get to do a lot to get to know you. And I'm really thankful for you. It is a great joy to get to do this with you. But there is no illusion here about why this is successful. This is successful because you 80 wanted to do this. And in a time when we have so much suffering and there's so much out there to do, and people are despairing, people like you, and especially you 80 here today, are committing yourselves to making the world a better place. And to be with you to do that is a total privilege. And so when I despair, when I want to give up, I think of you all. And I look at your pictures with your capstone and the memories of you in class, some hilarious things that have happened, some deep things that have happened. And I want you to know how much you inspire all of us, all these faculty, and all the people in healthcare. So thank you, graduates, for doing this and sharing this and making the world a better place. With that, Father Foster, if I can invite you to say a few words and to give us a sending prayer.
Just a couple words, unplanned actually. When I came back to Notre Dame in 1997, having been through medical school and residency and fellowship and private practice for a while, and then seminary formation here in the Congregation of Holy Cross, and was hired by the College of Science to work with Father Walter, my predecessor, in the Department of Pre-Professional Studies. One of the visions that I had was a sensitivity to the realities that Notre Dame could do a better job in preparing the many students that we have going on to medical school and to the health professions in general. That these 4 years were a very important time in the formation process. And that was a word that I got used to in the seminary, which was never really used back in medical school, formation. But the reality is, medical school is a formation process, and it is important that we be prepared to move to that next level. And so these 4 years are an important part of that formation process. And as we started to create courses, and I worked with Dominic Vachon in the ethics committee at St. Joseph Hospital here in South Bend, Mishawaka, I got to know him very well. And when this opening came in the Compassionate Care in Medicine Center, I just kind of touched base with him, sent him a quick email, kind of overnight. Would you be interested in coming to look at this position? And he was, and he came, and he's done this marvelous job with the creation of these courses and this formation process that now you have all walked through. And so I hope the work that he has done with you these years will be carried forward into the next levels of your formation down the road. So gratitude to you, Dominic, for so much that you have done. And so let us pray with and for these, our graduates. Good and gracious God, our hearts are grateful, thankful for the blessings of the past 4 years, for the opportunities you have given us as students, faculty, and administrators to work together in the search for deeper knowledge of you and understanding of your call to be instruments of your compassionate love. We thank you for the gift of friendship, for the gift of one another, and for calling us to this place, walking together as a community here at Notre Dame. Today, in a special way, we give you thanks for the gift of our graduating seniors and their families. Bless them and watch over them as they journey forth from Notre Dame. In the coming years, as they pursue a deeper understanding of how you are leading them forward on this journey of compassionate love, keep them true to this calling, so that through their future endeavors, they may serve humanity as they come to know you and love you more deeply. As you have called us to nurture the virtues of wisdom, zeal for service, and compassionate care for those you place on our path, we pray that you continue to inspire us to be bold, to be passionate, to be magnanimous in sharing them wherever we go. As you have journeyed with us during these years, we pray that you continue to guide our footsteps in the years ahead. Give us the strength to work to continue to build your kingdom of peace and justice until that day when we are all gathered together in your loving embrace. May the good work that you have begun in us at Notre Dame be brought to completion. We pray this through Christ our Lord. Amen. Do you want to send them forth?
Yes. So those of you where the PowerPoint blacked out, if you will, it's working well now. So if you'd like to come up with a picture of you in front of your picture, we can do that. So we can do that. Okay, we good? So my wife will see this on the recording, and I was always I choked up several times here. So, but Okay, there it is. So 32 years ago, as a fairly new medical psychologist, I came home and I said to my wife, I hate my patients. I did. I said because I was, saddened by what I saw. I was angered by people who took advantage of healthcare people, me, people not grateful, bureaucracies that I was learning how to deal with. And I came home and I said, I hate my patients. And my wife said, she's a licensed clinical social worker, she said, honey, you've got a problem. And she says, you've got to fix that. Because if you don't love people, they're not going to get better. And this is way before compassion science, but it's exactly what compassion science is. When we care for our people, when we care for our patients, when we love them, they will get better. And that's what I had to do. I had to go back to the drawing board to get that back. And it did come back. And a lot of this work was born out of that. And so I'm very grateful to be married to a person who knew what I needed and encouraged me to go and get it. Because that conversation has led to this being possible. So MJ, I know you're going to see this in recording, and I teared up even when you're not here, but can you join me in thanking MJ for that? All right, with that, I've got the clicker here. If you want your picture in front of your picture, feel free to do this. This is ours for a little while. So, all right. Thank you for coming, and have a great weekend.